About 1 in 6 men will be diagnosed with prostate cancer during their lifetime. Prostate cancer is the second leading cause of cancer deaths in American men. We spoke with Dr. Neyssan Tebyani at Mission Hospital in Mission Viejo to learn more about using robotic surgery in prostate cancer.
The prostate gland is a structure at the base of the bladder, and the urine passes through the prostate gland as it exits the body. Prostate cancer is a tumor or a malignancy that arises in the cells of the prostate gland.
And Dr. Tebyani told us about the symptoms of prostate cancer.
Prostate cancer itself generally doesn't have any symptoms. How we diagnose and detect prostate cancer is with the use of a blood test called a PSA, or a prostate-specific antigen, or an abnormal rectal examination where a nodule or a bump may be felt on the prostate.
Dr. Tebyani told us about the options for treatment.
Once the patient has been diagnosed, there are various treatment options based on the type of cancer, the amount of cancer, and the patient's age and overall health. The options range from observing the patient, or what we call active surveillance. The patient may choose to have radiation. There is a treatment option called cryotherapy, where actually the prostate is frozen using probes, or the patient may choose to remove the prostate gland, what we call a radical prostatectomy.
And he told us how robotic surgery is used to treat prostate cancer.
One of the treatments for prostate cancer is robotic surgery. And what that entails is removing the prostate gland, and then the bladder and the urethra are sewn back together, again reconstructing the urinary tract. And this can be done through small incisions, and we use special instruments that are attached to a surgical robot. Now, the surgeon controls the robot completely. The robot doesn't do anything on its own. But because of the detailed structure of the instruments, the small size, and the magnification that's offered by the 3D camera, the surgeon can do this very carefully and very exactly.
And what about the success rate using robotic surgery?
The robotic prostatectomy for the treatment of cancer that's localized to the prostate gland is very successful. And by removing the prostate gland, we can remove the cancer, and the patient should have a very high chance of success for being cured from prostate cancer. The other aspect of robotic prostatectomy is obviously the side effects associated with the surgery. The two main side effects that most surgeons talk about to their patients is control of urine or urinary incontinence and erectile function. And with the robotic prostatectomy, we can do a very careful reconstruction and sparing of the nerves that are used for erections. And this way, the majority of patients can expect to regain their urinary control and sexual function.